Imagine this, a condition. It can affect pretty much any animal, from the youngest calf right up to a mature cow. And it's not just uncomfortable.
No, it's definitely not.
It can have some really serious economic and welfare impacts. But here's where it gets, well, really interesting. The causes can be surprisingly varied, like anything from a simple cough, maybe certain diets, or even like subtle genetic things going on underneath.
Yeah, it's rarely just one isolated problem, is it? It's often more like a perfect storm of conditions that kind of comes together.
The perfect storm.
Understanding that interplay is really key.
And that idea, that perfect storm, that's exactly what we're going to unpack today. We're doing our deep dive into rectal prolapse in cattle.
Mm-hmm.
So for you listening, we've gathered insights from several key articles, research papers, all specifically on this topic. Our mission basically is to shed some light on what rectal prolapse actually is, how vets classify it, and maybe most importantly, explore that fascinating and sometimes surprising range of underlying causes.
Yeah, the why behind it.
Exactly. And also, the paths to diagnosis and effective treatment. This isn't just about like one specific vet condition. It's really about understanding this complex web of factors, how they impact animal health, and then, by extension, the wider agricultural economy.
It ripples outwards.
Definitely. So let's start right at the beginning. What exactly are we talking about here?
Okay. So at its core, rectal prolapse is the protrusion of rectal tissue through the anal opening.
Yep.
Simple as that, definition-wise.
But it doesn't always look the same, right? You mentioned severity varies.
Absolutely. It can vary quite a bit. Visually, you typically see this sort of cylindrical mass coming out.
Okay.
Initially, it might just look inflamed, maybe a bit red, but if it stays out for a while, exposed to the air and, well, everything else, that tissue starts to change. It can get darker, kind of harden up, and eventually become necrotic.
Necrotic meaning the tissue dies off.
Exactly, tissue death. And that happens because the blood supply gets compromised, squeezed off, essentially.
Right, okay. That visual progression sounds pretty critical for diagnosis then.
It really is. And while it might sound like something rare, it's actually relatively common in cattle.
Oh, really? More common than you'd think.
Yeah, especially in younger animals.
Yeah.
We see it quite a bit in feeder cattle, say between 6 and 24 months old, and also in beef calves, maybe around 4 to 6 months.
Okay.
But, and this is important, any animal can be susceptible. Doesn't matter the age, breed, or sex, really.
Gotcha. And the implications? They go beyond just that one animal feeling unwell, don't they? You mentioned welfare and economics.
Hugely. For the animal's welfare, I mean, it's inherently painful, it's distressing.
You can imagine.
You'll see signs of discomfort, restlessness, agitation, and that constant straining, vets call it tenesmus. That just makes everything worse. It really exacerbates the suffering.
And it gets progressively worse.
It does. It moves from that initial inflammation to potentially severe edema that's swelling, and then, like we said, that tissue necrosis.
Wow. And then the economic side for the producer.
Yeah, connecting it to the farm level, the economic hit can be substantial, even if you don't have, like, exact dollar figures for every case.
Sure.
It leads to real losses. Things like reduced productivity, maybe slower weight gain, less milk, plus the cost of vet visits, treatments.
Right, the vet bills.
And sometimes, unfortunately, it might mean culling the animal or even mortality. What's particularly critical for producers, though, is that rectal prolapse, compared to other kinds of prolapses, carries the highest risk of herd outbreaks and recurrence.
Herd outbreak, so it can spread, not like an infection, but...
Not like an infection, no. But if the underlying causes aren't figured out and dealt with across the herd, maybe it's dietary, maybe environmental, then you can see multiple cases popping up.
Ah, okay. So it becomes a herd-level management issue, not just treating one animal.
Exactly. If those root causes aren't addressed, it can keep happening.
Okay, so given that range of severity, how do vets actually classify it, put it into categories, and why is that so important?
Well, the classification system is absolutely crucial. It directly impacts getting an accurate diagnosis, it helps guide the best treatment approach, and it also gives us a better idea of the animal's prognosis, its likely outcome.
Makes sense.
It basically allows for a much more precise understanding of how bad it is, what type it is, and that's fundamental for getting a good result.
Okay, so there are different grades, I think, like grade 1, 2, 3, 4. How do those differ?
That's right. So grade 4, that's the mildest form. Here, it's only the rectal mucosa, just the very inner lining of the rectum that protrudes.
Okay, just the lining.
Yeah. And often it's intermittent. It might pop out when the animal strains, maybe during defecation,
Yeah.
and then it might just retract back in on its own.
Okay. And grade 2.
Grade 2 is a complete prolapse. So now you've got all the layers of the rectal wall involve the mucosa, the submucosa, the muscular layers, everything's coming out.
The whole wall structure.
Right. This type can also start off being intermittent,
Mm.
popping in and out, but it often becomes persistent. It stays out and needs intervention.
Okay. And then the more severe ones, grades the 3rd and 4.
Yeah, grade 3 gets more complex. This is where the prolapse might actually include part of the small colon pulled out with
Yeah.
it. Or it could be complicated by something called an intussusception of the large colon.
Intussusception. That's where the bowel telescopes into itself, right?
Exactly that. One part slides into another. So these grade 3 prolapses, they're typically much longer, visibly bigger, significantly more painful for the animal.
Ouch.
And the clinical signs tend to progress really rapidly. These need urgent attention.
Definitely sounds critical. And grade 3, the most severe.
Grade 3 is the most severe, yes. In this case, the anal sphincter itself is clamping down hard on the prolapse tissue.
Oh, wow.
That constriction severely compromises the blood supply very quickly. So you get rapid tissue deterioration and a really high risk of necrosis setting in fast.
So summarizing the signs then,
Yeah.
you see the tissue sticking out, it's red, maybe swollen,
Mm-hmm.
the animal's clearly uncomfortable, straining a lot, that tenesmus. And in the bad cases, you get that swelling, edema, and the tissue dying off, necrosis.
That's pretty much it. And of course, with all that, you worry about secondary problems. Things like infection setting in, sepsis, even tears in the rectum itself.
Right, the complications. Okay, that brings us neatly to the why, the underlying causes, the etiology. And you hinted this is where it gets complex, not always obvious.
Indeed. And what's often missed, I think, is that rectal prolapse is rarely just down to one single thing. It's almost always multifactorial.
Multifactorial, meaning several things working together.
Exactly. Usually it's a combination of factors that either A, significantly increase the pressure inside the abdomen, or B, weaken the muscles and tissues around the anus, the perianal support structures.
Okay,
Think of it like a balance. you
Yeah.
know? And something or several somethings tip that balance.
got it. Let's break that down then. First, the things that increase abdominal pressure or cause that persistent straining. What falls into that category?
Okay, so gastrointestinal disorders are a big one. Severe diarrhea, for example. That's a really common cause, especially in young animals.
Why diarrhea?
Well, the constant irritation and inflammation in the gut often linked to things like coccidiosis, that's a parasite, or colitis, which is colon inflammation.
Yeah.
It just makes the animal strain repeatedly.
Ah, okay. Makes sense.
Then you have intestinal impactions,
Mm.
blockages, basically. Maybe in the cecum or the small colon.
Mm.
The animal strains and strains trying to pass that blockage.
Right, trying to push it out.
Yep. And even something like abomasal ulcers, stomach ulcers, essentially. They cause abdominal pain. And that pain itself can trigger straining reflexes.
Interesting. What about diet? You mentioned diet earlier.
Yeah, diet's definitely relevant.
Mm.
Nutritional imbalances or certain feed types can play a role. High concentrate rations, for example.
Mm.
We see this noted particularly in feedlot lambs, actually, but the principle applies. It can alter how things ferment in the gut, and that can contribute to straining. Also, sudden abrupt changes in diet. That can sometimes lead to obstructions or digestive upset, again, leading to straining. Dietary consistency is pretty important.
Okay, that makes sense. Now, here's one that sounds surprising. Estrogenic substances. How does estrogen fit into rectal prolapse?
Yeah, that one catches people off guard sometimes. But excessive estrogen can be a factor.
Where would excess estrogen come from?
It could be from phytoestrogens, which are plant-based estrogens found naturally in some forage, like certain types of clover.
Ah, okay.
Or it could be from mycotoxins, those toxins produced by fungi, molds, sometimes found in feed, or even sometimes from hormones given therapeutically, maybe in cows undergoing embryo transfer protocols.
Right. So how does the estrogen cause the prolapse? Is it straining again?
Not directly straining, no. This is more about affecting the support structures. Estrogen can cause relaxation, the sort of weakening of the anal sphincter muscle itself, and the surrounding pelvic tissues.
So it loosens things up back there.
Exactly. It reduces the tone, the ability of those structures to hold the rectum properly in place.
Wow. That really highlights how different systems are connected, doesn't it?
It absolutely does. And that brings us to urogenital disorders, too. Problems with the urinary or reproductive tracts.
Okay. How do they contribute?
Again, it's often about straining.
Yeah.
If an animal has difficult or painful urination, the term is dysuria, maybe because of bladder inflammation, that's cystitis,
Mhm.
or urinary stones, urolithiasis, or even, unfortunately, tumors, neoplasia,
Mm-hmm.
affecting the urinary tract. All that difficulty makes them strain hard, increasing abdominal
Right,
pressure.
yeah, and calving, dystocia.
Oh, definitely.
Right.
Dystocia, difficult calving, involves massive, sustained straining efforts.
Yeah.
And critically, we sometimes see this sort of cascading effect.
Cascading effect.
Yeah, where severe straining from, say, a vaginal prolapse or uterine prolapse first can then secondarily cause a rectal prolapse to happen afterward.
Whoa! So one prolapse can lead to another.
It can, which means if you have a vaginal or uterine prolapse, treating that properly and promptly is absolutely vital to try and prevent the rectal one from following.
That's a really important clinical point. What about respiratory issues? You mentioned coughing.
Yeah, even something as common as a cough, if it's chronic and forceful. Think about conditions like bovine respiratory disease,
Yeah.
shipping fever. Those repeated, forceful coughing fits can also induce persistent straining over time. It just adds to that intra-abdominal pressure.
Okay, so that covers things increasing pressure and straining. What about the other side factors that weaken the rectal support or affect its tone?
Right, so neuropathy nerve damage is a really key one here that's
Uh,
sometimes overlooked.
Nerve damage.
Spinal injuries, for instance. You might see this from what they call riding injuries in young bulls, mounting behavior gone wrong,
Yeah.
or maybe spinal tumors, neoplasia. If those injuries damage the nerves controlling the anal sphincter, you end up with insufficient anal tone. The sphincter muscle just doesn't work properly. It becomes weak, maybe flaccid. And a weak sphincter simply can't hold the rectum in place effectively.
So the door isn't closing properly, essentially.
That's a good way to put it, yeah. The retention mechanism is compromised.
That makes a lot of sense. Is there an analogy, maybe?
Well, we see a clear example in sheep, actually, with tail docking. If the tail is docked too short,
Oh, right. I've heard about that.
it can damage the nerves supplying the perianal area, including the sphincter. And that's a well-known cause of chronic rectal prolapse in sheep flocks.
Because the nerve supply is cut off or damaged.
Precisely. And the principle holds true for cattle, too. Any injury, any condition, any procedure even that messes with the nerve supply to those perianal structures could potentially predispose an animal to prolapse.
Okay. What else weakens support?
Just general weakness of those perianal tissues themselves. Maybe the animal is severely debilitated from some other illness or in really poor body condition, just generally weak. That lack of overall muscle tone and tissue strength can reduce the structural support around the rectum.
So being generally run down makes them more vulnerable.
It can certainly contribute.
Are there any other sort of less obvious factors that might tip that balance?
There are a few others worth mentioning. Genetics, for instance.
Genetics. Is it inherited?
Well, it's considered to have a low heritability factor. The estimate is around 0.14, which isn't high.
Okay.
But the fact that there is a genetic component, however small, suggests that maybe over time, selective breeding could play a role in reducing how often it occurs in susceptible family lines.
Interesting. How would genetics link to it?
It might be linked indirectly, perhaps through temperament, like maybe certain lines are more prone to behaviors like excessive riding, which then leads to those spinal injuries we talked about.
Ah, so the behavior leads to the injury, which leads to the prolapse, and the behavior might have a genetic link.
Exactly. It's complex.
That is a surprising connection.
Yeah.
Anything else?
Yep. Obesity is another one.
Being overweight? How?
Excessive fat deposition inside the pelvis. That extra fat takes up space, increases the pressure within the pelvic cavity, and that can contribute.
Okay. More pressure again.
Right. And just general stress, too. Concurrent diseases weaken the animal overall. Even environmental stressors, things like overcrowding in pens, that might lead to more jostling, more straining behaviors.
So you can really see how it builds up, like you said, that perfect storm.
Absolutely. Imagine, a young calf, maybe already on a high concentrate diet. Then it gets a mild bout of coccidiosis, causing some diarrhea and straining. And maybe it has a slight subtle genetic predisposition we didn't even know about. Suddenly, all those seemingly small factors add up, and bang, you've got a prolapse.
Right. That paints a clear picture. Okay, so it's happened. A prolapse is identified. What's the next step? What can actually be done? How do vets diagnose and treat this?
Okay, diagnosis usually starts pretty straightforwardly. Direct visualization, just looking at it, and gentle palpation, feeling the prolapse tissue. That helps determine the type, the grade, and how much tissue is involved.
Assessing the situation.
Exactly. Then, depending on the case, a deeper dive might involve a rectal examination. gently feeling inside the rectum to check for any underlying issues, like internal masses, tumors, or strictures narrowings that could be causing the problem.
Looking for that root cause again.
Always. And if something more systemic is suspected, or maybe an obstruction higher up, then yeah, additional tests might come into play. Fecal tests for parasites like coccidia, maybe abdominal ultrasound, or even x-rays if an internal blockage is suspected.
Okay, so once it's diagnosed, what's the immediate first aid, let's say? What does the vet do right there on the farm?
The immediate goal is to protect the tissue and, if possible, get it back inside. So, first step is gentle cleaning, using warm, sterile saline solution to wash off any contaminants, manure, bedding, dirt,
Okay.
and then lubricating it really well. Again, sterile lubricant, maybe something with a mild anesthetic in it.
Yep.
This helps reduce further trauma and makes replacement easier.
And then just push it back in.
Gently, yes.
Yeah.
That's the goal. Manual reduction. Applying steady, gentle pressure to ease the tissue back through the anal opening into its proper position. Sometimes using sugar or hypertonic saline on it first can help shrink swollen tissue, making it easier to replace.
Okay, so you get it back in. How do you make sure it stays in? Prevent it from just popping back out?
Good question. That's where retention techniques come in. The most common is probably a purse string suture.
Purse string, like closing a bag.
Kinda, yeah. It's a suture placed in the skin around the anus, tightened just enough to narrow the opening and prevent the rectum from prolapsing again. But crucially, it must be left loose enough for the animal to still pass manure.
Ah, okay. That's a fine balance.
It is. Too tight, and you cause other problems. For more severe cases, or ones that keep recurring despite a purse string, other suture patterns might be used, like a bunner stitch or a modified horizontal mattress suture. They provide stronger retention.
Okay. But sutures are temporary fixes, right? What about the long term?
Absolutely critical point.
Hmm.
Those sutures are just holding things in place while you address the underlying cause. That is paramount. You have to figure out why it prolapsed and fix that issue.
Right back to the root cause.
Always. So that means treating the severe diarrhea, managing the respiratory disease, dealing with the parasites, correcting the diet, whatever initiated that straining or weakness in the first place. Without that, it's very likely to happen again once the sutures are removed.
So pushing it back in and stitching it is only part of the battle?
A small part, really. Supportive care is also vital. Things like anti-inflammatory drugs, NSAIDs, to reduce the swelling and pain associated with the prolapse and the repair. Antibiotics might be needed, especially if the tissue was damaged, contaminated, or necrotic, to prevent or treat infection. And, as we keep saying, careful dietary management is key, making sure the diet is balanced, maybe adding stool softeners temporarily to minimize any further straining.
Makes sense. What if it's really bad, like the tissue is dead, necrotic, or it just won't go back in, or it keeps happening?
Yet in those severe or recurrent situations, surgery might be the only option.
What kind of surgery?
Well, if the tissue is truly dead or so damaged it can't be saved, or it's physically impossible to reduce it, then amputation of the prolapsed portion might be necessary.
Removing the damaged part.
Yes. Or, for chronic recurring cases where other methods fail, a procedure called colopexy might be considered.
Colopexy, what's that?
That's where the surgeon surgically attaches or tacks the colon to the inside of the abdominal wall. This physically prevents that section of the bowel from being able to prolapse out again. It's usually reserved for those persistent chronic cases.
Okay. And after any treatment, whether it's just replacement and sutures or actual surgery, what's the aftercare like? And what's the outlook for the animal?
Post-treatment, post-operative care involves really close monitoring, watching for any signs of recurrence, checking for infection, making sure the animal's eating, drinking, and defecating normally.
The vigilance.
Definitely. And again, careful dietary management is crucial during recovery to prevent any straining. As for the prognosis, the outlook, it's generally pretty good for the milder cases, your grade 6 or 2 prolapses, especially if they're caught early and managed properly, including addressing the cause.
That's encouraging.
It is. But the prognosis becomes more guarded, more uncertain for the severe cases grade 3 or 4, especially if there's significant necrosis, infection, or if the animal has other severe underlying health problems going on.
And the recurrent ones?
Recurrent cases, yeah, they always carry a more guarded prognosis too, just because they indicate a persistent underlying issue or maybe complications from previous attempts.
Yeah.
They require more intensive management for sure.
Wow. Okay, let's try and sort of pull this all together. What we've really seen in this deep dive is that something that sounds kind of straightforward, rectal prolapse in cattle, is actually Well, it's this incredibly complex interplay, isn't it? Physical forces, how the body responds physiologically, even environmental stuff.
Yeah.
It really is a testament to how interconnected biological systems truly are.
It absolutely is. And if you connect that to the bigger picture, it just underscores how profoundly important a holistic approach is in animal health. You
Yeah.
can't just look at the prolapse itself.
Right.
Understanding all these multifactorial causes, everything from the feed bunk to genetics to nerve damage from an old injury that's absolutely essential if you want truly effective prevention and management. We have to move beyond just treating the symptom, the prolapse, and really get at those root causes.
Adjust the why, not just the what.
Precisely.
So this complexity, it kind of raises an important question, maybe something for you, the listener, to think about. Considering how all these seemingly unrelated things like an animal's diet, a chronic cough, maybe even an old injury can all converge and lead to a very specific, pretty severe condition like rectal prolapse, what does that tell us about the hidden connections, the hidden complexities in other areas of health, whether that's for animals or even for ourselves, areas where, maybe we're often tempted to look for just one single simple cause?